All right, guys, so I have an absolutely amazing clip here for y'all from Fox Business where they are going to lose their goddamn minds over Elizabeth Warren and Bernie Sanders critiquing the U.S. healthcare system in the aftermath of Luigi Mangione allegedly assassinating a top health insurance executive, Brian Thompson of United Healthcare. So let's go ahead and watch through this clip and try to work our way through and make sense of it as we go. This is absolutely amazing.
I'll say it over and over. Violence is never the answer. This guy gets a trial who's allegedly killed the CEO of United Health. But you can only push people so far. And then they start to take matters into their own hands.
Yeah.
We need regulation, in part, to rein those guys in.
The backlash growing against Democrat Senator Elizabeth Warren trying to excuse away and justify the cold-blooded murder of the CEO of United Healthcare, excusing away how he was shot in the back, saying can only push people so far. This wasn't the first time Elizabeth Warren said this. The senator also told the Huffington Post the day he was assassinated that his murder was, quote, a warning to insurance companies. Joining us now, Fox News contributor Joe Concha.
Okay, before we get to the contributor here, let's just read the quote, because if you notice, the thing that she pulled out from the entirety of this paragraph here is just this last bit of this last sentence here, where Elizabeth Warren said, this is a warning to everyone in the healthcare system, trying to make it seem as ominous as possible. But the entire quote is, quote, the visceral response from people across this country who feel cheated, ripped off, and threatened by the vile practices of their health insurance companies should be a warning to everyone in the healthcare system. Violence is never the answer. Interesting how she never got to this part of the quote. Violence is never the answer, but people can only be pushed so far. Then they start to take matters into their own hands. So what Elizabeth Warren is doing here is just sort of like a basic material analysis of the systemic violence that is baked in to the U.S. healthcare system. Now, this could apply to a whole, different variation of other parts of the U.S. economy and how we run our political and economic systems. But specifically on this, guys, we have millions of Americans who have medical debt. We have the number one cause of bankruptcy in this country is medical bankruptcy. We have people who die because they're trying to ration insulin because they can't afford the price gouging of big pharma in this country. We have people who die by the tens of thousands on an annual basis because they have inadequate access to health insurance. So what I think Elizabeth Warren is getting at here is that you have such systemic violence baked in to the U.S. healthcare industry that it is sort of inevitable that at some point, if you don't correct for that, that there is going to be a violent blowback as a result of that. Right? This is not a complicated analysis in the same way, and keep in mind, explaining how this works is not the same thing as justifying it. Nowhere in this quote will you see Elizabeth Warren saying, I love the fact that somebody got shot in broad daylight and was killed. No, she's not saying that. In the same way that if I was going to do an analysis of October 7th, for example, and I were to say, you can't keep people imprisoned in the world's largest open-air prison in Gaza decade after decade after decade and subject them to such amounts of systemic violence and oppression and not expect some sort of a violent blowback to that, which would be October 7th, that wouldn't be me justifying the killing of some innocent civilians on October 7th, right? Explaining how we got to some point as a society, whether domestically here in the United States or globally in terms of foreign policy, explaining that it's not the same as saying, I love that this happened. No, if anything, Elizabeth Warren is trying to explain how we could potentially approach fixing this system so that we don't get to this point in the first place. But instead, you have these Fox Business hosts who are saying, Elizabeth Warren loves murder. She wants you to go out and murder every person who is a top executive at top companies here in the United States. No, I mean, come on. What kind of conversation are we actually having here? But they continue, and somehow it gets even worse as we go on from here.
Joe, great to have you on. What do you make of this? Yes, you can talk about health insurance companies raising people's premiums, but not how they're talking about it.
This absolutely makes my blood boil, Liz, and I'm sure that's true of anyone sane and sober who advocates a civil society. These are, including Elizabeth Warren, Bernie Sanders has had the same sentiment. 2 U.S. senators that we're talking about, they've been in office for decades, and they think that shooting a father of 2 boys, a husband in the back like a coward on the street, like this 6'6" person, Luigi Mangione, did last week, they're saying that, Brian Thompson, the CEO, had it coming somehow? Both should resign from the Senate for this rhetoric. They are begging copycat killers to come along and start taking out other CEOs or anybody in a position of power whom they disagree with or whose industry they disagree with. Every Democrat on Capitol Hill should be asked if they support or condemn this ridiculous, reckless rhetoric. The same kind of rhetoric, Liz, by the way, that Democrats used that nearly got Donald Trump killed twice, including once on national television. I mean, look.
Okay, wait, hold on. Trump had 2 prospective assassins in 2024. One of them was Thomas Matthew Crooks, who was killed on the spot, and who also had a background, according to the people who knew him growing up and according to his registry and everything like that, as more so of a right-winger, right? A former, Republican voter. So that was one of the prospective Trump assassins. The other guy was like a Ukraine fanatic who had a very complicated and bizarre past. Nowhere in this situation, okay, of the Trump assassins or would-be Trump assassins, could you include Democratic socialists or leftists or people who are critical of the U.S. healthcare industry. You're trying to connect 2 things here that have absolutely no connection whatsoever, and trying to imply that Bernie Sanders and Elizabeth Warren are responsible for the assassination of this healthcare CEO because they are willing to, call out the corruption, the systemic violence of the current status of the for-profit U.S. healthcare industry. No. That's not how any of this works. But also notice how this guy is melting down, freaking out, losing his goddamn mind over this as some sort of a violation of civil society in terms of the assassination, but has absolutely no issue, again, with tens of thousands of Americans dying because they can't afford adequate access to healthcare, and because of hundreds of thousands or millions of Americans going bankrupt for medical bills. No outrage when it comes to that system. He has no issue with health insurance CEOs making tens of millions of dollars, with wealthy Wall Street shareholders making millions upon millions, with the health insurance industry price gouging the American people and making tens of, or if not hundreds of billions of dollars off of the suffering of the American people. No outrage about any of that. But here comes his outrage on Bernie Sanders and Elizabeth Warren. Okay, we continue here.
I thought that Obamacare was supposed to bring down the cost of health care and premiums, and the opposite has happened. Are we going to hear criticism from Elizabeth Warren about the architect of Obamacare or the president it was named after? Doubtful. Liz Warren and Bernie Sanders should be shamed into oblivion for this, as should every member of the media.
Okay, I can't speak for Elizabeth Warren, but I do know that Bernie Sanders has been critical of Obama's approach to the health insurance industry. Obamacare, although it did take some positive steps in the right direction in terms of protecting people for pre-existing conditions, etc., it also didn't go nearly far enough, and it didn't implement the Medicare for All system that he fights for, but, not exactly sure what he's talking about there.
Media, by the way, that is turning this lunatic into a sex symbol. It's nauseating as a father, as a human being. I'm sorry.
We hear your passion, and you're justified here. I mean, yes, we know, we've talked to hospitals, people work in hospitals. Obamacare has tangled them into a fishing net pile of, regulations. But it seems like they're really breaking their oath of office. They swore an oath to defend and protect Americans, but it's the depraved radicalism on the far left among the anti-capitalist Democrat socialists, the same political figures who attacked Trump. Now, Senator Warren later tried to walk back her comments, saying, quote, "I should have been much clearer. Is never a justification for murder." She was saying, though, you only can push people so far, and it's a warning. And now AOC, listen to this. Alexandria Ocasio-Cortez said today, "This is not to say an act of violence is justified, but I think for anyone who's confused or shocked or appalled, they need to understand that people interpret and feel and experience deny claims as an act of violence." No, they don't. No, they don't feel claims as an act of violence.
Yes, they fucking do. Yes, they absolutely do. Listen, what Alexandria Ocasio-Cortez is saying here is a very simple phenomenon, okay? If you have a life-threatening illness, if your family members have a life-threatening illness, or if they can't afford their prescription drugs, and a private for-profit corporation is profiting off of denying them access to the healthcare that they need, that could legitimately lead to not only, deleterious health effects, but could directly lead to their deaths. That is violence. It's systemic violence. It's a little bit different than pulling the trigger on a gun and killing someone in broad daylight. Sure, it's a different type of violence, but it absolutely is still violence. But these Fox News hosts are so out of touch that they cannot even fathom how average working class people who struggle to afford healthcare, who struggle to afford premiums, who struggle to actually get access to the healthcare that they need to survive, they are totally out of bounds in terms of understanding how they would interpret the current status quo of the US healthcare system as inherently violent. This is absolutely violence. It's just a different form of violence. It's structural violence that they seem completely incapable of understanding. But they continue here.
Need to understand that people interpret and feel and experience deny claims as an act of violence. No, they don't. No, they don't feel claims as an act of violence. Talk about the liberals pumping up the violent rhetoric and why they should step down.
AOC, of course, I mean, that is horrible rhetoric. But I want to hear, for once, from this person. She complains a lot, doesn't she? She goes on Instagram and TikTok and talks about how horrible everything is. Oh, if only you were in power. Oh, that's right, you are in power. What is your solution, AOC? Tell me, how are you going to bring down the cost of healthcare and premiums? Because it seems your solution is government-run healthcare. Go to Canada sometime. Next time you feel a lump in your chest or something where you need some sort of emergency procedure, you will wait months, and that thing could only get worse. So, yeah, go to Canada, go to England. I want to hear a solution from this person for once, instead of just complaints and ramping up this rhetoric that's going to get somebody else killed.
Okay, so, I mean, this is the best part of the entire clip, right? I mean, credit to you if you waited throughout the entirety of this, because he asks, what's your solution? What's the fucking solution? What do you mean, what's the solution? The same thing that Bernie Sanders has been calling for probably, 4 decades straight in this country? What do you mean? What's the solution? Oh, scary government-run healthcare. We're talking about Medicare for all, okay? It is a single-payer, government-run health insurance system. That's all that it is. That's all that we're talking about here. It's not anything crazy. In fact, it's so not crazy that basically every other developed country on the face of the fucking planet has some variation of this kind of system where they have universal coverage, okay, that is not profit-centered at its core in the same way that we have here in the United States. This is not radical. This is not crazy. This is not going to lead to worse health outcomes and it's going to lead to exorbitant costs or whatever the case may be. The current status of the U.S. healthcare system is this. I mean, disregard Sanjay there. We have the U.S. spending the single most on healthcare, and that's both in a total sense and a per capita sense, amongst developed countries on the face of the planet, but has the worst health outcomes amongst these high-income countries. So we're paying more under our current system than any other country, and we're getting worse health outcomes. So what exactly are we to do with this kind of information, right? According to this contributor on Fox News, nothing. Everything is working fine. If anything, we should continue to defund programs like Medicare and Medicaid, and we should hand it more so off to the privatized for-profit health insurance companies that are ripping you off, price gouging you, bankrupting you, potentially leading to you not being able to receive the care that you need to survive, right? That's his idea of a solution. And he has the audacity to go on national news in front of hundreds of thousands, potentially millions of people who saw this clip, and to say, AOC has no solution. Bernie Sanders, Elizabeth Warren, they have no solution. No, the solution is very obvious. It's been staring us in the face years and years and years now. This is not complicated. It's not difficult to understand. It is basically just, how do you want to pay for and run your healthcare system, right? Do you want it to be centered around profits for wealthy, multi-millionaire executives and Wall Street shareholders? Or do you want the healthcare system to be centered around providing healthcare for people?
Politic guy has the best politic. Believe me, no one does it like him. Believe me. Everyone is saying